like I should have a thing.
I'm just gonna call him. I'm gonna call him quick because I don't see it popping up on our Facebook. So. Hey, it's Travis. Are you guys ready to take this press conference? Okay. I don't see it on Facebook yet. Okay. They're about ready to start here any minute, so you can put it up. All right. Sounds good. Thanks. We're good. Yeah.
I hadn't heard that. We're on the way.
Hey everybody, happy Monday. I'm glad to be with you again today. As usual, I will go over some state and local case numbers, and then I have a few clarifying points and some announcements. And then I also want to share with you a strategy for addressing COVID-19, one that we've already been utilizing, but I thought it would be helpful if the community had an understanding and awareness of how the operations fit together across healthcare, our partners, and the health department. So starting out, in the state of Wisconsin, we have currently 1,221 positive cases. That is up 109 from yesterday, and yesterday was up 123 from the day before. So we continue to climb around 100 cases or so each day. That's been a trend for several days now. The state has also looked at the number of negative test results and found that there were some duplicates. So the current number of tests at the state level that are negative were 15,856. In addition, the state has an additional death that it reported, so the state is up to 14. In Crosse County, we, over the weekend, received our 16th case, and just before this media conference, we received our 17th case, so we currently have 17 cases. Number 16 was in a male in his mid-60s, and he is experiencing mild symptoms. Case number 17 is a female in her mid-70s, and she is experiencing severe symptoms and is currently hospitalized. So that is our first hospitalization relating to COVID-19 in Crosse County. The good news is that a total of 9 cases have now been considered cleared from isolation. Of course, they still stay home because we're all in a stay-at-home order. However, that is very positive news, that 9 of our 17 cases have technically recovered. We have had a couple of questions in regards to testing, so I just want to go over a few items related to testing. First of all, in regards to negative tests, there's a reason that we aren't able to yet report negative test results in Crosse County. So our 2 healthcare systems run tests for many, many counties, and it's been a process that we've been working on to help sort of weed out what number of negative tests in there are Crosse County residents, so that we're not inaccurately reporting other people's residents. So we've not yet figured out the best way to do that and make sure that we don't have duplications. As you can see, even the state had worked through that process, so that's something we continue to work on. We know that that's something that individuals in our community are interested in. We do still use the Wisconsin measure as an understanding of how many tests are being done in the state as a whole, because of course our tests would be shared with the state number. We also have questions about, again, why we are not testing everyone and why there is a testing strategy. So I just want to go back over some of this. There's several reasons why we have a strategy with regards to testing. So first of all, we only have so many testing supplies. That is not yet a resource that is widely available. In addition, we need to make sure that where those tests go is really specific and strategic, and that has to be for those that are hospitalized first and foremost, so that we know the healthcare workers who are caring for those individuals know if they need to be, if that patient has been hospitalized and has COVID-19, that helps assure the level of PPE. So they're already using that, but if someone is not positive for COVID-19, then we don't have to be burning through the personal protective equipment like we would if somebody is positive for COVID-19. In addition, we need to make sure that we don't have spread amongst our healthcare workers. So healthcare workers would be part of that tiered approach to assure if they do have COVID-19 that we are really quickly responding to others that might have been exposed. And there are others that fit into those tiered strategies as well, but those are some of the big ones. We also want to make sure that anyone who is at a high risk of severe disease, so those with underlying health conditions or immune system function that is compromised, that those individuals, that we test them to make sure we can be really on top of those individuals that might quickly and dramatically decline in health status. So a couple of announcements to share with you. I received word that Governor Evers announced a new public-private partnership to help increase the laboratory testing capacity in the state of Wisconsin. So this new partnership now includes lab support from a number of locations, including UW Health, Marshfield Clinic, Promega, and Exact Sciences. And these organizations, along with the Wisconsin Clinical Lab Network, will now share knowledge, resources, and technology to help improve our testing capacity in the state of Wisconsin. So that is good news. Next, I want to just share a little bit about an overall strategy for us to, as a community, really work through this particular situation with COVID-19. And I do so at this juncture for a reason. I want the public to be aware that this is not just a response that has no foundation and baseline. So we operate at the health department level at always having evidence base behind what we do, and always being very structured along the prevention continuum. So you may have heard me in the past talk about primary prevention, secondary prevention, tertiary prevention, and I want to share a little bit about those types of prevention and what falls underneath each of those areas, so you can see how places like businesses and healthcare fit into that overall strategy for our community. So this is not just the health department strategy, this is a community-wide strategy where partnerships fall in alignment, all to cover that continuum of getting at the ultimate goal, which really is to decrease death and illness relating to COVID-19. So it's a very simple goal that we state, but it's difficult to achieve. So within that particular goal of decreasing death and illness from COVID-19, under the primary prevention aspect, we're looking at things like mental health and assuring that individuals understand how this can relate to stress, how to take care of stress, how there can be trauma triggers associated with situations like this. It also relates to external partnerships. So this is primarily relating to information sharing. So we think about at the beginning of this outbreak, we were rapidly sharing information with school administrators and business leaders and childcare providers and long-term care facilities to make sure that they understood and were preparing for what might happen and being ready with their policies and pulling out their emergency plans. In addition, it includes community aspects such as the food pantries and thinking about food insecurity and how we can assure that those things are still covered in the midst of something like COVID-19. In secondary prevention then, we're looking at identifying and limiting the spread of disease. So this looks at target populations that we're concerned about that either might have severe illness or might have the potential to spread it to others, or might be those that are traveling widely, or those that we're concerned about with outbreaks. So this could be locations like long-term care facilities. It could be the homeless population and wanting to make sure that we have sheltering in place for them so that we don't have outbreaks in that community. It could be looking at the college population and how we addressed when university students came back from spring break and had been on top of connecting with them and assuring that they got appropriate guidance about where they might have traveled. So all of those fit here, and we've been doing this all along. In addition, it looks at additional conversations with businesses and work from home policies and helping, again, we don't do all of this ourselves in the health department. We work with our partners to assure that this information is getting shared. So places like the chamber, talking with their members about work from home policies. And then finally, in tertiary prevention, this is really about improving outcomes. And this really is in alignment with a lot of what the healthcare systems in particular are doing. This is about being ready with surge capacity so that if we have a large influx of patients who have symptoms associated with COVID-19 or are positive for COVID-19, that they are able to care for them. They have the supplies, the personal protective equipment, the healthcare workforce to be able to care for those patients, all again to improve outcomes so that we don't have deaths and we don't have lasting illness. It also can include other portions of the workforce, thinking about how do individuals get to their healthcare provider if they call ahead and they're going to go in for an appointment. Is there medical transport? All of these sorts of childcare pieces with healthcare workers so that they can go to work. These are all parts of an overall strategy, and I thought it would be important for the community to understand that we have a strategy for the entire community, and it is operationalized by partners working together. So I've often talked about that, but not necessarily laid out the strategy itself and helped the community to understand that. So I thought that would be helpful information, and we'll be happy to share more. But going forward, I think when we do these media briefings, we're going to be trying to bring in our partners in alignment with these strategies. So for example, on Friday, we would try to bring in our healthcare partners and talk about what's happening in the healthcare workforce or in the healthcare systems. And then maybe on Monday, we would bring in someone to talk about the mental health aspect to directly address stress and how to reduce anxiety in times that are unprecedented. So we'll be working to align our messaging with these strategies going forward. So at this time, I'll take questions and answers.
So this sort of strategy, did you work together with other counties to sort of come up with this, see what they're doing, or how did the planning of this sort of all come together?
So the question is, how did the planning of this strategy come together? So this is the type of strategy, so these varying levels of prevention are what health departments do all the time, what public health is made of, so to speak. So this is Crosse County's strategy. I don't know that other counties have specifically laid out a strategy, but if they did, it would look very similar to this. I think for us it's just helpful because as we communicate with our public about why we're asking something in particular or where a particular topic falls, for many in our community it can be really helpful to understand how it fits in conjunction with the larger picture. So we do this sort of strategic thinking in public health all the time, and we've been using this from the get-go of this experience. We just put it on paper so that we could share it and it would be more transparent.
Takeout restaurants are still going. Is there any special monitoring being done to make sure that food is still safe?
So the question is, takeout restaurants are still going. Is there any special monitoring going on to make sure that that food is safe? So we know that particularly some types of businesses are just opening for the season. So we have made close contact touch points with many of those to just talk through making sure they understand how COVID-19 might change the way that they operate. Those businesses can't have like an open area for seating, for example. So if it's a drive-up location, we want to make sure that the person who's doing the serving is being screened. So we have had communications with businesses in that regard, but takeout is safe, and we have communicated and talked with many businesses And we continue to share the message that takeout is safe.
Is that all part of the health inspections that are routinely done?
So the question is it part of the health inspections that are routinely done? So it is, those communications are happening by the same individuals that do typically do the health inspections, but they aren't formal health inspections that are happening. So those sites get an inspection every year. It doesn't mean that they're getting an inspection right now to assure that they're in alignment, but they are getting a conversation.
Do you have any specifics about the new cases? Mentioned that one of them had severe symptoms and required hospitalization. What were those symptoms that required the hospitalization?
Yeah, so the question is, what were the symptoms with the individual that required hospitalization? So that individual became known to me just before the start of this media conference, and so all I was able to receive so far, because that electronic disease surveillance report had just come in, was the gender and the age and the fact that the individual is hospitalized. So I will certainly have more about that later.
Was there any issues over the weekend with the stay-at-home order that you noticed or heard any complaints about out in the public?
Yep, so question about was there any issue with the stay-at-home order over the weekend? So we have heard that there might be some small groups of individuals in the community that have been seen by others. In addition, there have been some businesses that have felt that they were essential but did not fall under alignment with the order. And so in all of those cases, that gets reported to non-emergency dispatch, and they follow up with law enforcement, having a conversation and trying to get compliance with the order and explaining and showing a copy of the order to those individuals. And then if the compliance is not met, then the district attorney's office is notified.
Is there any signs out there that the virus has mutated at all, that it affects certain areas of the country or certain populations different than others? Is obviously New York is a case where people are focused on as far as deaths, but here only one hospitalization out of the 17 cases. Can you talk about any science out there?
So the question is there any science out there relating to populations that the virus is hitting, and or if the virus has mutated, or regions of the country where that mutation might be more prominent? So we have not seen any science that the virus has mutated. What we are seeing in some of the models, and remember these are models, not real yet, but it's meant to be predictive of how this virus might be moving across the US, is that we know that many more cases are on the coastline, so the east and west coast. There is some models that are indicating that that spread is moving towards us, and we have the majority of our cases are in the south and southeast region of our state. We may see that move towards us. So I think this is not a time to be complacent with the stay-at-home order. We need to be following that because it is really a critical moment to see if we can reduce the spread of this. We have had, thankfully, not a lot of cases, and we don't get large jumps each day. So I think that's good news, but it's early, and we need to make sure that we are continuing to follow the governor's order because that will make a difference in our state.
You mentioned that we haven't really had that sort of spike. Do you expect a spike coming at some point here in the future in La Crosse County?
So the question is, do I expect a spike to come? So I will expect that we'll have a peak. I'm hoping we don't have a spike. I'm hoping that we have this slow, steady increase and then a slow, steady decrease. That is what we're really looking for. That's sort of that low bell curve that we're looking for. It seems to be going that direction right now, but at any given point that can change, which is why we have to continue to follow that order and stay home and really reduce our travel wherever possible.
We're getting some questions too about, can you just sort of lay out the guidelines again for childcare facilities, what from the health department's perspective?
So the guidelines for childcare facilities, I'm not an expert on those guidelines. There are guidelines that have come out from the state for those facilities, and we have pushed those guidelines out to those facilities. So In particular, what I will touch on is that we need childcare for healthcare workers and essential workforce. Otherwise, we have very needed positions in our community that maybe cannot be in their work line because they have children at home that need to be cared for. In addition, our guidance has been that if you are providing childcare, it should be you should be not allowing children to come into your facility if they have any respiratory symptoms, including a fever. And we follow the same guidance with regards to making sure that they are at least 7 days since the start of their symptoms and 72 hours where either their symptoms are improving and they don't need to use any fever reducing or cough suppressant medications or other medications to reduce their symptoms, and they have not had a fever for those 72 hours.
Any updates on the funeral attendee that was also at a local restaurant? How is that person doing? And how many people came forward saying that they had contact with that person?
Great question. So the question is, any updates on the individual that was the funeral attendee and the number of people that came forward and let us know that they were at that funeral? I don't have those numbers with me right now. Our operations section follows up on those cases. But what I can tell you is that it was a lot. We had well over 200 responses, and we knew that there were about 300 at that funeral. So we heard a lot from individuals who thought they might have been exposed. I think it was a really successful outreach, and I want the community to know we will do that again if we have a situation where we are unsure who might have been exposed. We will be absolutely willing to share that information. So I know we hear a lot that we don't share where people have been because we trust the processes in place for determining who's been exposed. But in situations like attending a funeral or being at a box store where they have had symptoms, we will share that information and we'll use the same process to have people tell us if they were in that location at that time.
What advice was given to those 200 people? And also should be taken by those that haven't responded.
Right, so right now, because we have community spread, so the question was what advice was given to those individuals who contacted us and told us that they might have been exposed. Since we currently have community spread, the situation is such that really everyone may have, could be exposed if you're out and about. The goal would be that you're not out and about and that you are really reducing your travel only to those things that are essential, and that if you have been potentially exposed, you are already staying at home, but now you definitely need to stay at home and you can't do essential travel for the 14 days to assure that you don't have symptoms developing.
Any word on how that first individual is doing, if you're able to say?
Yeah, so because there are 17 cases and our operations section follows up on all of those cases, I'm not intricately involved in each of those cases. I can't recall specifically which individual that was, so I'm sorry that I can't answer that question right now.
You mentioned the peak that you hope will come at some point. Is there any evidence, or not evidence, but I guess any models that suggest when that peak might come locally?
Yeah, so the question is, are there any models that suggest when the peak may come? So I don't know if this is specific to Crosse County. However, I have seen models that indicate anywhere between the end of April and the middle of May is when we might see the peak. So we do have to remain very patient with this process. That's a big ask, we get that. But that will allow us to keep case numbers without big spikes, to have that sort of low and slow growth of cases and then decline of cases to make sure that we don't overwhelm our healthcare systems.
This strategy here that we all have a copy of, where can the public find this sheet of paper, this strategy that's outlined?
So the strategy, we will put a copy of that after this media conference on our website, lacrossecounty.org/COVID-19. We'll also share with you guys a copy of it for you to place on your websites if you'd like. And Greg, I want to come back to your question about that individual I forgot was not a member of our county, so I don't have information on that particular individual.
This past weekend, obviously President Trump extended his social distancing guidelines, and as you just said, the peak could be mid-May. I think people understand why they have to do this, but it's still maybe discouraging. What would you say to people who are realizing this isn't something that's going to go away in a matter of weeks?
Yeah, that's a good question. So the question is, what would I say to individuals that that this may not go away in a few weeks? I would say that try to be patient with this process. Change is hard, and change has been fast and furious with this particular situation. This is unprecedented in terms of having something like this spread across our country. It's very difficult for that change to occur at multiple levels for individuals in our county and across our state, but we are all in this together, and if we continue to all be in this together, we will get through it together, and that's what community is all about, and that's who we are here in La Crosse County and our surrounding areas. We are about community. We help each other. We work together, so it's really a message of hope that we will get through this. It may be a little longer than we would like it to be, but if possible, I think our perspective really makes a big difference. And if we can look at this in a way of, you know, this is an opportunity to maybe spend more time with our families. We often say we work too much, and maybe we can spend more time with our kids. Maybe we can help them do some homework. Maybe we can call and talk to our moms and dads daily if we weren't able to do that before. So while it's difficult that we can't see our family, there are lots of options, and if we get creative, I think there's a lot we still can do.
Hey Jen, we got a question from Facebook. If you have already gotten COVID-19, can you get it again?
So the question is, if you have gotten COVID-19, can you get it again? I think we still need to find this answer out, but my initial thought is that our bodies, our immune systems are able to create antibodies, and so if and when your body sees this particular virus again, it will be able to take care of that virus so long as your immune system is functioning properly. That's how the normal disease process works in the body, so we would believe that if you were exposed to it again, that you would not have at least the same level of symptoms, if any at all. So I think it's still information that we're trying to research and determine how that works as this moves throughout the world.
We got another question. Can you talk about false negatives in testing?
So the question is, can we talk about false negatives? I'm not aware of a large number of false negatives. What I think that person might be alluding to is that sometimes you can have a negative but still potentially have virus, and we call this viral load. So this is how much virus is in the body. There's a possibility that the amount of virus in the body at a time early in the exposure period might mean that you don't trigger a positive result in the test. However, as I've looked into this further, I think that if it doesn't trigger the test, it also likely means you're not very communicable, which means the ability to spread that would not be as high as when the viral load is higher. So perhaps that's what the person is asking about in terms of having a test that's negative, but you might still have COVID-19. So that's why I think the stay-at-home order is really important. But I would say that in general, a negative test typically means it is negative, especially if it's tested well into the exposure period, but it is possible. Okay, thank you everyone, have a great day.
Thank you.